Hi everybody, this is a video about fluoroquinolone toxicity or folks being floxed. Just before jumping into the crux of the video, if you don't mind taking a quick second to either like or share or subscribe or post a quick comment on this video, I'd really appreciate it. And also, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted a question on one of my videos, and it's about fluoroquinolone toxicity. I've posted at least one or two other videos, I believe, about fluoroquinolone toxicity, so I won't rehash that information there, so please feel free to check that out. Probably easiest to search my YouTube channel for those past videos if you're so inclined to get more of a backdrop. So jumping into the question. So it says, would you be able to do a video that talks more about treatment for fluoroquinolone toxicity? Is liposomal glutathione enough, or is there more to the treatment process? So there may be folks out there who have a great resolution of symptoms from glutathione alone. I haven't met any of those patients, but it might be out there. But generally, the approach that I take to fluoroquinolone toxicity is very similar to the approach that I take with folks dealing with other types of complex chronic illnesses. So if we know that it's been induced by fluoroquinolone toxicity, that's really valuable, or it was induced by a fluoroquinolone exposure, we know that's valuable information because then we have this, definitive history telling us that the mitochondria have been badly damaged and are likely being damaged on an ongoing basis due to the nature of fluoroquinolones, where they can essentially stay, kind of the residue of them can stay stuck inside of cells for a very, very long time, unfortunately. So we know that there's a notable mitochondrial issue, so we know we have to rehabilitate the mitochondria in that case, and we also know that we need to make sure that we take away as many of the other factors that might be negatively impacting the mitochondria as well. It would be really interesting, in my opinion, for there to be some type of a study done to see folks who have fluoroquinolone toxicity, what's the incidence of them having concomitant issues with, say, mold toxicity or Lyme and co-infections or mast cell activation syndrome or SIBO or other types of gut dysbioses or whatnot, heavy metal accumulations, etc. My strong suspicion is that if they were to do a study looking at that, my strong suspicion is that probably 90+% of the patients who were really negatively impacted by the fluoroquinolones had some pre-existing exposures that maybe they were asymptomatic, felt totally fine, as many people who get floxed do feel fine before they get floxed, but that there were other underlying issues that were already priming the mitochondria to be just unable to weather the storm of the fluoroquinolones. And the reason I suspect that would be the case is because, of course, so many people tolerate fluoroquinolones just fine. And granted, many folks who have pre-existing persistent borreliosis, co-infections, chronic viral infections, etc., they might be put on a fluoroquinolone incidentally for a urinary tract infection or some resistant pneumonia or something else, and they tolerate it just fine. So thankfully, not everyone is susceptible to being floxed, but those that are, of course, it's a really awful, devastating thing when it happens. In terms of the treatment, it's support the mitochondria comprehensively, go after Lyme and co-infections if they're there, go after heavy metals if they're there, support detoxification pathways. It's all the kind of standard stuff, treat mold, etc. And so that's it. Really, in my experience, has required quite a comprehensive approach to get things on track. Intravenous ozone therapy can be a real asset to these folks, and then sometimes working with higher doses of minerals can be helpful. Then again, I talk about this in my other video, but unfortunately, fluoroquinolones can sequester certain really crucial minerals, and then that deprives these other cellular structures, including the mitochondria, of those minerals, so they can't function properly, and that just really exacerbates things. I guess the one other thing that's a little bit unique with folks who have fluoroquinolone toxicity is that doing treatments to directly support their tendons can be really helpful. So I've had some patients with fluoroquinolone toxicity where, as we're supporting the mitochondria, treating the root causes, etc., we're also I shouldn't say root causes, the root cause is the fluoroquinolone toxicity, but treating the other factors that might be negatively impacting the mitochondria. We also do injection therapies like prolotherapy, ozone injections, platelet-rich plasma therapy to help support those tendons and reduce pain and improve function in the process. That's not always a good idea right out of the gate with treatment, because sometimes those treatments are just too much too soon. You can throw a patient into a flare, so there's definitely an art form to know when to apply the treatments, but that is something that can be quite useful and maybe not as common in folks who have, say, mold toxicity or Lyme or what have you. Let's see here, other questions here. How does being floxed affect a person with Lyme or chronic illness already? Yeah, it just makes things like a lot worse and just yeah, it just really adds a lot of insult to injury, unfortunately. But as mentioned just a minute ago, it doesn't really change the treatment trajectory a whole lot. Per se. The next part of the question is, most of what I've seen online is really depressing. It seems many people don't get better, or if they do, only marginally. What are my thoughts? I've had patients with fluoroquinolone toxicity who have become completely well. So it's an achievable thing for some patients, at least. I can really only speak to who I've seen in my practice, what I've heard from other colleagues as well. Some patients definitely struggle, and I've certainly had patients where we're trying to get some headway and we're not seeing results fast enough, and patients discontinue working with me. So I can't say that every case that I've treated has been a success. I can't think of a fluoroquinolone toxicity case though where we've kind of hit a point where I don't know what else to do for you. So I guess unless the person got to the point where they, I don't know, had permanent neurological damage or something like that from being floxed, then I think that I always hold out hope that there is the potential to heal. And I've found that in patients who are able to do the full treatment course that I've recommended, I've seen really good results. It's not always fast. It's rarely fast. Every once in a while it is rarely fast, but I have seen very good results. So I don't look at those cases as being depressing, oh my gosh, we got a 10% chance of seeing some headway here. Not in my experience so far. I'm sure there are cases out there that are very, very difficult, that are maybe beyond help. I don't know, but from what I've seen, that's my best answer. And then let's see here. If I understand what the paper says, she was referring to a paper that I had cited in the other video. I think it talks about how fluoroquinolones can allow there to be heavy metal buildup. So absolutely, it can definitely interfere with cellular detoxification, that it affects our regulation of copper and iron. I'd have to check the list there. I don't think copper is one that is specifically impacted by fluoroquinolone toxicity, but I don't remember definitively off the top of my head. Iron, it does, to my recollection. So that's super big problem because iron is really important for lots of things, including mitochondrial function, and fluoroquinolone toxicity is really a sad story of mitochondria being just unfortunately devastated by that antibiotic. So thank you for the questions. Always love the opportunity to talk about fluoroquinolone toxicity. It's a very appreciated, under-recognized, under-known about condition, but yet really, really important for clinicians to know about it so they know how to help patients, or at least refer to folks who are able to help them. And so really important thing to know about. So thank you for the questions. If anybody has any comments about this or questions, please don't hesitate to post in the comment section below. If you yourself have been dealing with fluoroquinolone toxicity or dealt with it in the past, and you don't mind sharing some of the things that were helpful for you, be great to hear about that, because at the end of the day, where it is such an acknowledged, recognized condition, quite frankly, there just aren't that many resources out there for clinicians even to learn about this. I've had to piece it together from different conferences and talking to other colleagues and whatnot, and just seeing what I've observed in clinical practice. So always great to hear about what's helped other folks, or what hasn't helped. That's also valuable knowledge. So we have a better sense of which basket to put our eggs into. So on that note, I will leave it there, and thank you for your attention.